Welcome to another episode of Instrument Innovations. Today we're going to be talking about sterilization of instruments, specifically our eye instruments. There's a little bit different process that we do with our eye instruments, so we're going to be talking about that today, talking about the risk of if we cut those corners and don't do it the specific right way. So today I have a group of people with me that I'm going to let them introduce themselves. We will start with our newest one because I believe uh, we've had Ivan before, but we're going to start with Carrie and Justin. Have them introduce themselves, tell us what they do within the company, and then we'll get moving from there. So, Carrie, go ahead and start it.
Hi, I am Carrie Schumacher. I'm a regional platform specialist with Asenco.
All right.
Hi, I'm Justin Heins. I am an analytics engineer here at Decenco. So I handle creating visual analytics as well as in-app reporting.
Okay. And Ivan, I know you've been with us, but go ahead and introduce yourself again anyway.
Sure. I'm Ivan Zavortink. I'm a platform specialist, so I work with a single client to help them optimize their software usage and manage their data.
Okay. So what we're going to do is we're going to talk about sterilization. We'll just talk about what it, a brief workflow of how any instrument will go through a sterilization process. So normally after they're done in the OR, it'll come down to decontam. And once in decontam, it'll go through a manual clean, and then it will go to what we call our automated or some type of machine um, clean. Some instruments will go through like your vendor or some instruments or your ortho instruments that may have some body fluid or something on it after it's gone through a manual clean. It may go into our sonic where we use cavitation or the little bubbles to get in those areas that we can't get to and clean that stuff out. And then it'll go through a machine wash. And then from there, it goes over to where what we call the clean or the assembly side to where it's inspected and ready for sterilization and then sterilization. But our eye instruments go through this workflow, but it's a little bit different um, of a workflow. So let's just kick that off. And with that workflow, how are our eye instruments just a little bit different in that workflow? So who wants to start that question up? Not all of
Uh,
us.
I guess the biggest thing is that because the eyes are such a small, sensitive organ in the body, it's very important that there's an extra level of cleaning and rinsing associated with those instruments. So I think the biggest difference in the process is a lot of sterile processing departments have a separate area for cleaning eye instruments, sometimes a designated sink, sometimes a designated ultrasonic, and then just making sure that they're using critical water when they're being cleaned and being rinsed appropriately just to minimize the potential for any kind of contaminant to remain on that instrumentation when it's used on the eyes.
Okay.
And could I also interject and add into there using softer bristles because of the delicate, not something so abrasive like we would with other instruments, and making sure that we're not diluting or uh, making the chemicals stronger, upon irritant of the mucous membrane for the eye.
Yep. So, so we're talking on that. What happens, let's say, because the guidelines are mapped out for a specific reason. And so what happens if we or well, before we even go there, let's talk about because you kind of touched on it a little bit, Carrie. So let's talk about what some of those general cleaning guidelines are. Ivan, you mentioned the critical water. explain um, critical water. What does that mean by critical water, and why are we wanting to use a specific water versus just why wouldn't we just use tap water?
Yeah, so there's differences in pH and different minerals in the water. So we want to have critical or deionized water as much as possible, so we make sure that we remove water quality from the equation, that you know it's high quality water, that there aren't any other additional contaminants being introduced to the instrumentation as it's being cleaned.
Okay. Anything to add on that, Carrie or Justin?
Um, no, I mean, just very important. I mean, you know how it feels when you open your water or open your eyes in salt water. So definitely making sure that everything is rinsed properly.
Okay. So when we talk about rinsing and we talk about, is there a time frame, a certain amount of time frame that we should rinse those, or how do we know that that it's rinsed thoroughly before we go to move to our next step on it? Are we just rinsing until we don't see any more of the
I
detergent that we're using, or
I think the rinsing is going to be based on the detergent that you're using and the instructions that you should follow on the detergent label, and or what the IFU is for each individual eye instrument.
okay? You
Um,
mentioned IFU. So what is IFU? What does that
uh,
mean?
in, Instructions for use, which it could also uh, mean like a MFU, manufacturer's use. So it's instructions on how to clean and sterilize the surgical instruments or equipment that comes directly from the manufacturer that created that item.
Okay,
Yeah,
okay. And then
off of
even
that,
when we're, oh, go ahead.
I was going to say, just jumping off a little bit with that, with Carrie mentioning IFUs, if you have potentially conflicting informations between the instruments and detergent for like timeframes for IFU, you want to use the more stringent. So if instruments are saying a certain amount of time
Absolutely.
and detergent is saying less time, follow what the instrument is saying.
Exactly. And then it even gets down to details about can we wash when we're putting it in the washer? Can we wash those instruments with other instruments in the washer, like our ortho instruments, or do we have to do them on a specific cycle by themselves?
I don't think that washing them in an ortho cycle is the best practice.
Hmm.
They are a very delicate instrumentation,
Right.
so having the heavier ortho instruments could possibly damage, ruin, bend.
Hmm. And when we're talking about cross contamination, we also want to make sure, even though we've done our manual clean, even though we've done our putting them into the ultrasonics and stuff, we still want to make sure that we're doing best practice in everything possible. So we also want to put them in that washer on the gentle cycle, to Carrie's point, so that they're not being damaged, but also on that cycle by themselves, so that they're not exposed to another cross contaminant. Even though we're washing it in the washer, it's not the stuff that we can see that's going to get us the most. It's the things that we don't see that's going to get us. So best practice, if possible, we're going to make sure and put them in the cycle by themselves.
Yeah,
So
typically a delicate or yeah, gentle cycle.
absolutely. So what are some of the specific risks when it comes to the eye instruments if we're not following? What issues or what are some of the risks related to those eye instruments if we're not following the manufacturer's IFU?
I think one of the biggest things with eye instruments is how delicate of instrumentation they are. So if
Hmm.
we're not properly following IFUs, there's high risk of damage for those instruments, which, if unnoticed, can go down the road and potentially cause issues in the surgical room.
Okay.
Correct.
Um, and then there is a something called TAS. Tell me about that. What is that, and why are we so worried about that when it comes to the eyes?
That's toxic anterior segment syndrome.
Hmm.
Uh, yeah, so that's a potential complication from an eye procedure. And so that's apparently a rare, but it can impact individual sight uh, from those procedures. So that's the biggest concern related to eye procedures and potential infections.
So when it comes to cleaning those instruments, why are we so specific about that and making sure that those instruments are cleaned a specific way and making sure in relation to TAS and cleaning of the instruments?
I believe it's to not cause blindness would be,
Hmm.
a great feature, and also because your eye is located very close to your brain. So if there is any infections that could develop, it is, very close to your brain and subjecting to infection that way.
Absolutely. So, are there any other special considerations when it comes to the eye instruments? We mentioned that we want to make sure that we're using the correct pH when it comes to the detergent. We mentioned that we want to make sure that we're using critical water. We made sure that we want to use a ultrasonic that is um, specific to the eye instruments. You see in a lot of areas they'll use like a tabletop ultrasonic on those. We also mentioned that the washer specifically to um, on the gentle cycle and only those instruments by themselves. Are there any other? I don't believe there is, but are there any other
I
considered
do.
considerations?
Yeah, like if you're going to be using air or so the PSI in the air, the pounds of pressure per square inch is very important in eye instruments because you could also then ruin the integrity of the item, and or um, when you're subjecting it to sterilization. So when you're doing a sterilization, I believe it's 15 minutes is the most that you're supposed to have it for a certain PSI. Maybe Ivan could or Justin could chime in on that. But I know that there is a limit of the amount of PSI and the time of the PSI.
Correct. I'm not specific to what that PSI is, but you are correct in the pounds, the PSI or the pounds of pressure of air you're putting on those instruments. And then also when we're inspecting those instruments after they've come out of the washer and they've gone inside, what are we inspecting as far as those instruments goes, and how are we inspecting those instruments?
I think the
If
big thing, just like any instrument, just inspecting them for cleanliness
Mhm.
and function, making sure that they're intact, checking the lumens, making sure
Yep.
that those are clear as well.
When we're checking those lumens, there's something called a boroscope. Tell me about how to use a boroscope with those instruments.
Boroscope is like a fiber optic camera, so you can run it through the lumen instruments, so you can see down into a channel and check for any debris or whether it's bioburden or
Not
something else.
sure if you can see it, guys, against my white my white shirt, but there is a little
Bring it
tiny
over a
camera.
little bit. So what Carrie is showing
Uh,
us is, and I don't know if you can see it, kind of put it into the camera a little more.
I don't know where the camera is.
There
There
it is.
you go. We got it. So
Where
what Carrie
to?
just showed you is that is what we call a boroscope. It's a little fiber optic tip, and it's small enough to go down into that lumen to where you can inspect inside of the lumen and to make sure there's no bioburden or biofilm down in those instruments, and do a visual check of those.
I
So
think an important note for consideration with the boroscope is making sure that it's a small enough diameter, not to pose any
correct.
risk of damage to the lumens of the eye instruments as well.
Very good point. Very good point. Because we want to make sure it's small enough to go down in there and inspect it and not cause any more damage. or any damage to the eye instruments or lumen, whatever lumen that we're inspecting. So just to do a what we talked about today is we talked about eye instruments. We talked about how the workflow is a little bit different. We talked about the specific risk when it comes to eye instruments. And we talked about what the process is of cleaning those eye instruments. We talked about using separate ultrasonics as well as a washer. We talked about using softer bristle brushes so as not to damage those instruments. And we talked about the special considerations as well as the risk of why we're doing the eye instrument. Thank you guys for meeting with me today. That's all the time we have for Instrument Innovations. We'll see you next time.